Let me invite Mr. Sanjay Jha, who's the founder for Apan MedTech, co-founder for Collateral Medical, and the former board member for HealthCube, to please join us on stage and share his vision on the topic. Please, welcome, Jha. Ladies and gentlemen, we have to have a little more energy in the room. It's right in the morning. Thank you. Thank you, sir.
Good morning, everyone. So it was very interesting, and thanks Dr. Suchita Makan. She talked about IIT Kharagpur, and I'm very proud to say that I'm an alumni from IIT Kharagpur. And normally I don't get to see IITs in the healthcare forum. So good to see that. Well, it's both an honor and privilege to welcome you to the 4th edition of the National Diagnostic Forum and Awards. When we launched the first National Diagnostic Forum in 2023, we had clear intent not to create just another industry event, but to build a movement, a platform where diagnostics professionals would not only discuss challenges, but co-create solutions, where innovation would not just be showcased, but accelerated, and where excellence would not merely be celebrated, but systematically cultivated. 4 years later, as we gathered here today, it's humbling to reflect on how far this forum and the industry itself has come. So I'm from a small town in Bihar, okay? And after luckily getting into IIT, after graduating from IIT, I moved to US. And in 2001, I joined GE Healthcare. That was the first time in my life I got exposed to the world of healthcare or medical equipments. And I worked in R&D on CT scanners. Those CT scanners which you would not have seen in India in those days. Very highly priced, very high-tech, amazing for the other parts of the world, not so great for India. Then I decided to come back to India, did my MBA, came back to India and started working with Johnson & Johnson. And even Johnson & Johnson had a business called OCD, also clinical diagnostics. Many of you would have seen that. Again, very high-end products, 3 crore, 4 crore, 5 crore. Amazing for big businessmen, nothing there for small guys. Okay, nothing there for the people from the place where I am from. But things are moving slowly and slowly. Then I started a venture called Collateral Medical, where we started building distribution for tier 3, tier 4 distributors in India. And I could see then the COVID came. And I could suddenly see that there's a lot more focus on public health, on public diagnostics, especially from the government. After that, I got on board of a company called HealthCube, where we started making a POC devices. It was a small box which you can take to any small city and you can do some 60, 70 diagnostics. Now I help startups. I have recently came across a startup who have finally got a US FDA approved product. So across the time, I could see how things are changing from the things which were just on paper existing in India to things which have become reality in India. Okay? And I'm so proud to be part of that movement. What we have seen lately is now we have companies like TransAsia coming in, okay, enabling small diagnostic centers to run. Now we have companies like C3 coming in who do 60 to 70 home collection. Earlier, I remember in my childhood, if you had to go to a diagnostic center, it was very scary. Okay, it's like you don't want to go there in those places. It looks like, boss, ye itna problem kyun ho gaya life mein, right? So, but this evolution is not accidental. It mirrors the profound shift underway in Indian diagnostics itself, from fragmented services to integrated solutions, from reactive testing to predictive medicine, and from manual processes to technology-enabled precision. And you might know this, but nearly 70% of all clinical decisions globally are driven by diagnostics insight. And scale in India is very different altogether. In India, we do 3 to 4 billion diagnostics tests every year. This makes diagnostics a core pillar of national healthcare infrastructure. But even after doing 3 to 4 billion diagnostic tests, less than 1/3 of our population has timely access to quality diagnostics, particularly outside major urban centers. Even now, when I go to my village, the diagnosis center there is around 15 kilometers away from our village. That's still the sad situation of India. But things are amazingly improving, and I'm very, very hopeful. So diagnostics is not about machines, tests, reports. It's about people. It's about patients and profound trust they place in us when they seek clarity about their health. Having spent years in this industry, I can say with conviction, this is the most exciting era Indian diagnostics has ever seen. This responsibility is magnified in a country where over 60% of healthcare expenditure is still paid out of pocket. Most of the preventive diagnostics which we do, at least I pay from my own pocket, right? And that's what we see. People, the moment it comes to diagnostics, pre-admission to the hospital, you still end up paying in majority of the cases. We are quite literally part of the foundation upon which modern healthcare stands. Forums like this remind us that we are not competitors fighting for market share. We are collaborators advancing a shared mission to make diagnostics accessible, affordable, reliable, and actionable for every Indian, regardless of geography or socio-economic status. Thank you, and I wish you highly engaging and impactful forum.
Thank you very much, Mr. Jha, for that wonderful presentation there, sir. Thank you. Now, ladies and gentlemen, I want to bring a startling fact here as we start with our presentations now moving forward, as you've heard from the perspective of leaders. Now, even before diagnostic actually starts, the accuracy doesn't really belong in the lab. It actually is much before that. It is when how the samples are actually moved, how they are protected, how reliable they are, did they reach the right place at the right time. So logistics becomes a critical aspect even before the diagnosis starts. And dealing with this is our parting partner, Credent Connect N Care, which is C3. So we want to also start today's presentations with our partner presentation, where we want to talk to you right on the onset, even before diagnosis start, where is the actionable aspect starting from. So let me take this opportunity to invite on stage Mr. Tarun Sharma, who's the founder and CEO for C3, to please step up onto the stage and talk to us about the same. Welcome, sir.
So, good morning, respected dignitaries, industry experts, and colleagues. It's a privilege to be here at VOH Diagnostic Forum, Edition 4. I sincerely thanks to Dr. Naveen Nischal for creating this impactful platform that brings healthcare leaders together. I representing here as a founder to our company called Credent Connect N Care. One-liner, we all believe that accuracy begins inside the lab. But in reality, diagnostic accuracy is start at the patient's doorstep. If pre-analytics are not on a place, not error-free, trust me, patient never can get outcomes better. So without wasting that much more time, so we are into the industry from 2012. We started this career 14 years back with Dr. Lalpath Lab. We started our journey. Now we are working and providing the entire pre-analytic solutions. Either it's a home sample collection service, either is a IOP, shop-in-shop, clinical research, entire movement of blood samples from any of the tier 2, tier 3 kind of cities. We in-house having our learning and development entirely, we called as Connect and Grow, जहाँ पर हम पूरा का पूरा entirely जितने भी type of trainings हैं, we can develop these trainings to our staff. We virtually give it to them. After that, we having our own entire corporate wellness plan where we provide the services called PFT, ECG, any kind of corporate services we can provide the same. So this is our journey from 2012 till 2024. So we started with 7. In 2024, we having 4,500 plus, and now we are having approximately 5,500 plus 6,000 approximately numbers as a fleet called phlebotomist and the network. So as we are in a B2B partners for all the diagnostic companies, we maintain our integrity, we are serving to all, and we give the dedicated support. This year we are expanding in Middle East, we are coming in Abu Dhabi, we are starting with Dubai and all. So if we can talk about in India, our reach, we are catering more than 450 cities. We are serving approximately 23,000 pin codes on a daily basis. We having our regional offices, and we serve more than 50 plus clients at pan-India level. So today the topic was pre-analytics. As I told, pre-analytics is more important in diagnostic. So there are the 3 aspects where the sample collection, sample handling, and the logistic transportation. Many kind of problems are facing by the industry. It's called incorrect patient identification, improper tube selection by a phlebotomist, inadequate sample volumes, poor vein puncture techniques. So either in the sample transportation, transit delays, lack of real-time visibility, improper cold chain management, temperature exertions. So for these, what exactly comes? Wrong diagnosis, delay in treatments, increased healthcare costs, loss of trust and credibility by the patient to the diagnostic company. So now being in Credent, we can believe that we can serve in a better way, we give you better outcomes. So we use the technology, quality check, training of the staff, and temperature control. So in these 4, we can talk about technology. So we having entirely in-house tech developments where we track the samples from the collection till the sample reaches to the lab. Either it's a part of home collection, either it's a clinic. So entirely complete ecosystem for the technology we having inside. So for learning and development, same we having our virtual and the physical both. If we can talk about the phlebotomy part, so we're proud to say we are the largest one in a network in India. 23,000 pin codes is not a number, but no one can individually can serve. So it's all about the team and the technology by which we can maintain all these things. So what exactly we assure you ki to temperature control, logistic is not only the outcomes, it's also in decreasing your cost, maintaining achievements. So we are trying to build entire ecosystem from the procurement, logistics, home collection, serving to the patient, and the sample reaches in the lab. In a B2B, we try to build entire complete ecosystem for the healthcare logistics. So thank you, ladies and gentlemen, for giving me this opportunity to